It's just, every system is built a little different. There are joint ventures, there are management agreements, there are wholly owned subsidiaries. There's so many different, there's so many I don't know, personalities and politics associated with rolling out the technology that I don't think people recognize is actually there.
You're spot on, and also that plays into what another observation is, like, that people's expectations are that it would be as simple to use as their like consumer apps, like OpenTable you mentioned. Like, that's kind of, if you haven't built these or have some experience, you initially think, oh yeah, I'll just adopt some tools, throw them in there, and everything will just work, just like OpenTable. But to get that to work, like I'm not an expert in OpenTable, but they had to get agreement on those processes. All of the people who all the restaurants, they need to abide by certain rules and follow the instructions, and the workflows are not nearly as complicated as they are in healthcare. But it gets at one of our big observations with this is just how inefficient this is. Like, every health system trying to figure this out on their own, like harmonizing all the data and figuring out all these processes. Like, for the most part, we didn't see that they were able to learn too many lessons from others. Some had figured out and were able to standardize, and it certainly wouldn't be possible to have everything perfectly standardized across the whole healthcare system. But we couldn't help but notice that there was a lot of reinventing the wheel going on these fundamental activities.
Yeah, so people are starting to do work on essentially improving the performance of the system. Obviously, things usually start with monitoring and providing feedback to the providers, but then we start to move to some more sophisticated things, population health, implementing evidence-based procedures. You guys identify some of this stuff, reducing variation of care. These are some of the initial projects that you were finding. And just so everybody's clear, I mean, you did this research over a 2-year period. Is that right?
We did. We conducted the like 128 interviews, I think, over a 2-year period, finished in 2019. So this was before the pandemic. The situation might be a little bit of different, but given the time frames that people were telling us, like, I mean, it was taking, some of them were just beginning to set up an analytics department, and like the time frames they were looking at was generally in the 5 to 10 year time frame. So these are like long-term efforts. So if I were to guess, I wouldn't guess there'd be that much more advancement in the last couple of years, just because things take so long.